Well, good morning, everybody. I hope everybody is doing well and good to see some familiar faces. Let's see here, and I think we may have some newcomers here.
Mhm.
It's kind of exciting. We had a few people that have recently signed up for the program or they have found out about me, so I welcome them. So let's see, anybody with some questions can raise your hand. Robert, you're on my screen here. You look like you're eager with a question.
Well, we discussed a little bit about the recent research on the mRNA vaccine causing some eye problems. I wonder what you thought about that.
Oh no, I'm seeing it. I'm seeing it every day
You are.
and hearing about it every day. There's no question that it causes a lot of damage in some people that are susceptible.
Oh, boy. That's one thing.
And there's been a lot of work with in homeopathy. I belong to the American Institute of Homeopathy, and they've detected some homeopathic remedies that can help.
Uh, uh, want to thank you so much. Yeah, I was wondering about that. Yeah.
Yeah, so if you do feel that you are having some eye symptoms or problems that might be related to the vaccine, please contact Chris, and then I would have a one-to-one with you to review your symptoms, how they are, how it's affecting you, not
Yeah.
only your eyes, but maybe your strength and other issues. And then we might be able to, you know, uh, find a good homeopathic remedy.
Okay, wonderful. Thank you, Doctor.
Sound good?
Thank you.
Okay, let's move on.
Okay.
Let's move on to Renee. Renee, how are you?
Good.
Good morning.
Um, do have a question. My MD, ND that I check in with on a regular basis. She always muscle tests my um, list of supplements and things that I take on a regular basis, my vitamins and things. And every time she's always checked your homeopathic, she says it's fine, but this last time she said it was not doing anything for me anymore.
Hmm. Well, I'm not a big advocate of muscle testing. I
I
think there
didn't
could
think
be
you
a lot
were.
of false pay. But I want to see how it's affecting you. So if you're disappointed and if you feel like it's not really working or you're getting some strange symptoms, let's set up a time where we can review everything. We may want to change it.
Okay. So just contact Chris.
Just contact Chris.
Okay.
And so, homeopathy is wonderful. We like to get a good remedy that makes a change in your body. Either gives you, a better disposition, makes you feel better, gives you more energy. Ideally, with homeopathy, we're treating the whole person. And as you become stronger, it's going to help improve your vision.
Okay.
Yeah,
I will get in
let's
touch with
talk
her.
about it. I'm always interested in, fine tuning the homeopathic remedy. So if you feel that it's not doing anything, then let's investigate it.
Okie doke.
Okay, let's move on to Barbara. Barbara.
Hi, can you hear me?
Yep, I hear you coming through.
Okay, it's telling me I'm off, but okay. I have a question because it's never happened before,
Oh, we
but
can't see you. Would like to see you.
I can't figure. According to me, I'm on.
No, you're on, but did you click the video?
Yeah, video filter. I'm on a page now. I can't get off of.
All right. Well, anyway, we'll just
You don't need to see me anyhow.
no, just imagine you're a beautiful lady, and
That's all the reason you don't need to see me. So what's happening now is that in my right eye, which is my good eye, it's got an ache in it. Not all the time. It's not a pain. It's like an ache in my eyeball. I don't understand that.
Now, something new,
Yes. Yeah, I never had that before.
The softest one is
and what
October,
treatments are you doing right now?
right? But that should be all right.
Somebody's talking over you. What did you say?
What treatments are you doing right now? Are you doing anything new, or what's going on?
Well, I got my reprogrammed, upgraded microcurrent back, and I'm doing the number one every day. I've got the light therapy I'm doing. I'm taking the vitamins and blah, blah, blah. So I'm doing all the stuff I've been doing, except that I was without my machine for a few weeks while I sent it in. And I got it back this last week and went right back on to using it. But now I'm
Well, you may
finding,
want to, number one, make sure that you're properly hydrated. A lot of times, if you're dehydrated and you do the microcurrent, you can get some ache and discomfort because toxins are formed.
oh,
The most common complaint I hear with people doing the microcurrent is they have pain, headache, or discomfort, and it usually means you're not properly hydrated. So
oh,
drink plenty of water. It could be that your body's getting adjusted to the new frequencies. But if it persists, let me know. We're either going to maybe have to, readjust your machine.
yeah, well, let me try the water first. That sounds logical. I'm not a
Yeah.
big water drinker, so,
Oh, you got to drink plenty of water. That's one of the biggest problems I hear from a lot
okay.
of patients.
Well,
If you're
that's an easy fix.
dehydrated, you're going to get into trouble when you do the microcurrent. Did you ever get a massage? And the first thing after a massage, what does the massage therapist give you? They give you a glass of water and they
$123.
want you to drink it.
We
Yeah.
spent another 100.
Yeah.
Well, that's an easy fix. So I'll try that and we'll see in 2 weeks.
Yeah, half your weight in ounces of water. All right.
Okay. Okay.
Oh, Jennifer's drinking some water there. Good. Being an example for all of us. All right. Let's move on to Phyllis. Phyllis, good morning. You have to unmute. Phyllis, are you there? You have to unmute. Phyllis disappeared. Phyllis, are you there? Well, if we missed you, then put your hand up again so I can see you. Enid, let's move on to Enid. Hello, good morning.
Good morning. Good morning, Dr. Kondrot. I have a question about red light. I know because you made it clear the last time we had a meeting is that it was not a good idea for red light to be directed to your eyes if you have wet MD. However, there is a red light that works supposedly very well for the ears for hearing, and it's just directed with like headphones, earphones into the ears. And I also have a hearing problem. So I just wondered if that would be problematic for the eye for any reason.
No, as long as you're not directing it into the eye,
No, right.
putting the red light into your ear should not cause a problem.
Okay, and just quickly, I've been trying to arrange a follow-up homeopathic consultation, which you asked for 2 weeks ago, to no avail. I got one call back from Chris and I missed it, and I tried calling many times again and nothing. So,
Well, that's the problem playing telephone tag. The best
yeah,
thing to do is to join Chris's meeting every
okay,
Wednesday at 2.
okay, I'll
And
do
then
that.
you set up a time then. That's the best way to do it. Because we have
Okay.
that problem all the time. Chris is only one person
I know, and I know she's very
and
busy.
she
And
she calls back, but phone tag is a big problem. So the best way is to either schedule a time, go to freeconsult.us. You can actually schedule a specific time with her. That's one way.
That's a good idea. Okay,
So
thank
go
you.
to freeconsult.us, you go into a scheduler, schedule a time, and she'll call you, or go to the Wednesday meeting at 2.
Okay, thank you. Good suggestions, both.
And I look forward to doing a follow-up with you.
Thank you. Me too.
All right. Jasmine, good morning to you.
Good morning, doctor, and good morning, everyone. I'm so thankful to be here in this platform. My mom is your patient, and she has vascular dementia, but she's taken the treatment for glaucoma. And before we started her treatments, the microcurrent, the eye drops, the homeopathic remedy and the light therapy, her pressure was in her bad eye, her left eye was 33, and in the other eye was 17. And with the drops, the doctor said there was nothing more we can do, just maintain. And about 3 months later, she went for a follow-up, and her pressure in her bad eye was down to 17.
Wow, wonderful.
And, yes, and her good eye was 11. And they said that when they did the vision test in her good eye, her good eye actually improved.
Mm, I'm happy to hear that.
Yes, thank you so much.
And
And
how's
so,
her mental functioning?
her mental functioning is much better now. There was a time when I had to I hired a caregiver while I was working, and it really aggravated her.
Mhm.
But now that everything's a little more normalized, I noticed that her personality, she's just more easygoing, less debative, so I even noticed that in her as well, just more calm.
Yeah, well, I think that, homeopathy and the microcurrent and the light therapy can work miracles, for mental problems, dementia, memory, so. And then, glaucoma is, a lot of people consider it kind of like dementia glaucoma, because you get damage and death of the optic. Alzheimer's, dementia, glaucoma, may be related in some way. I'm happy that she's doing better, and thank you for sharing it with us.
Yes, you're welcome.
And keep us posted, okay?
Yes, certainly.
Okay, let's move on to Jennifer. She finished drinking her glass of water.
It's always good to be reminded. I wanted to ask you how you recommend using the supplement that you recommend, the enhanced garlic EDTA. It seems to me you said a capsule a day, but I just wanted to clarify that.
I think a capsule a day to start. I think the
Okay.
recommended dose is probably 3 capsules, 3 to 4 a day.
Right.
You want to get up to 1,000 milligrams of EDTA a day.
Okay, got
I
it.
think on the bottle, it may be either 3 or 4.
I think it may say 3, right?
3
And I'm
would be
doing
1,000 milligrams, yeah.
Yeah, I'm actually doing IV chelation therapy. I'm going to do one more before I'm retested, and there's something they give you that day, the DMSA, I think it is, to take
Mhm.
the day of. But okay, thank you.
All right. Okay, move on here. Carol. Good morning, Carol. I think you have to unmute, Carol.
Can you hear us now?
Yep, I hear
Yeah.
both of you now.
My husband, and he's got a question or two, if they could.
Yeah. Doctor, have you conducted any group studies for glaucoma with your glaucoma patients that we can
Yeah.
see the results of?
I have. You can go on my homepage. I published an article in a peer-reviewed journal, and there's a subset on glaucoma.
So homepage, and what was the next
Let me show you exactly where it is, because other people may be interested.
Yeah.
You must be an ex-engineer.
No, I'm an artist.
It's the engineers that want studies and data. Let me find this here for you. I'm going to do a share screen. Okay. You see the website right here?
Okay.
You go to healingtheeye.com right here. Peer review studies by Dr. Kondrot.
Is that up at top that you're pointing to, or?
Yep. And this is one outcome studies. This is an article published in Alternative Therapies in Health and Medicine. This is based on my 3-day program, but you can go here. Then I have a subset here, all about glaucoma. Here's glaucoma
Okay.
here, and you just heard from a patient who had her pressure drop significantly and vision improve. We had an example, the lady that spoke earlier, but these are statistics here: number of patients I treated and improvement of vision, pressure, contrast, etc.
So one more time, where on your homepage do we get to this one?
Let me show you here.
Okay. I'm trying to follow your arrow.
Okay, just go to healingtheeye.com,
healingtheeye.com.
my website. Right at the top there, it says peer review studies published by Dr. Kondrot.
Okay.
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 Thank you.
Right there. Okay, let's move on. Phyllis.
You can't watch that on your tablet.
Can you hear me?
Yeah, I can.
Is this Phyllis?
Yeah, can you hear me?
Yep, I hear you and I see you.
Get it for you.
Oh, great.
I can go in my
Finally figured it out on my phone.
I can go in
How
my-
are you?
Real good. Thanks for asking.
I'm wondering if I need to see my ophthalmologist every 3 months or 6 months. Do you have a recommended amount of frequency for that?
Well, I think that if you're stable, if your condition's stable, probably only 6 months. But if
Okay.
vision is fluctuating and maybe we're trying to evaluate whether, the alternative treatments are working, then maybe every 3 months. But if we reach a point where your vision's stable or you're improving, probably every 6 months. I do think it's important that you keep in touch with, your ophthalmologist or optometrist.
Yeah.
So we
Okay.
get some data points, how's your pressure, how's your vision,
Right.
etc.
Yeah. Okay. And my second question is, so in using the ozonated saline solution, does it, when you get down to a little bit of saline solution, does the ozone get super concentrated on there and cause stinging to the eye or not?
Yeah, it may, you have an increase in concentration and you may have a little osmolarity. So what I would recommend, if you are getting some burning towards the bottom, put a little bit of distilled water in, dilute a little bit with
Okay.
distilled water.
All right. Okay. Thank you very much.
I would try that, but always make sure that you reozonate. I guess the risk is if you don't reozonate properly, bacteria might grow and there may be a contaminant. But remember, ozone destroys the bacteria and
Okay.
viruses, so there shouldn't be an issue with contamination.
So on the machine, it has it for different lengths of time that you ozonate it. So would it be better to do it a shorter time when you have less saline
No,
solution
I
to
think
ozonate?
I'd recommend at least 10 to 15 minutes should be enough.
Okay. All right. Very good. Thank you very much.
All right. keep us posted.
All
Let's
right.
move on to Sue Gordon. Sue, how are you, Sue? Good morning to you.
Good morning. I'm good. How are
Good
you?
morning.
On Monday, I go back to the cornea doctor because of the issue I'm having with dry eye, and they label it punctate keratitis. And he asked about my contact use. So he actually notated that it could be due to excessive contact wear. I noticed in your book the hypericum remedy literally says can help with issues with corneas due to contact excessive use. Have you used that much in people?
Well, I don't like when people relate one homeopathic remedy for punctate keratopathy because we treat the person. So
Yeah,
actually, there are probably about 40 homeopathic remedies that could help. So hypericum is one of them, and I would not recommend taking it. What I would recommend highly is ozonated saline. Ozonated saline, I think, will help.
I do that all day long.
And
Well,
then,
hopefully,
if the doctor feels it's contact lens overwear, then maybe your eyes are reacting to the contact lens. You should probably decrease the wearing time.
I've worn them maybe 8 hours in the past 9 months. Yeah, this has been going on for about 9 months now.
Mhm.
So, all
Well, we
right.
may
Well,
want to look.
I'm gonna do a follow-up after this
Yeah,
appointment
we may
with
want to
you.
look at. We may want to look at changing your homeopathic remedy.
Yeah,
Also, I think diet and nutrition is very important for folks that have dry eyes.
okay.
You got to eat more omega-3s, the healthy omega-3s
Yeah.
like flaxseed oil, borage, primrose oil. I'm not a really big advocate, as you know, of fish oils.
Yeah.
So I like the plant-based oils. And keep yourself hydrated. If you're dehydrated, you are going to have dry eyes. So,
I drink plenty of water. Sometimes I wonder, um, I heard a video the other day, they say to be really hydrated in your cells, you should only go to the bathroom 3 or 4 times a day. Well, I go 3 times that. So I just wonder if I'm even like absorbing it in my cells. I do put Celtic sea salt in my water.
mm,
I know on my scale it says I'm about 47.3% hydration. Is that high enough, or don't you really know
I'm not aware
what
of that
percentage?
percentage.
Okay.
I know that
All
a
right.
baby probably has like maybe 60 to 70% hydration. And as we get older,
Okay.
if you're 80 or 90, you have like 10 to 15% hydration. That's why you see older people, their skin starts to get shriveled and they look like a prune.
Yeah.
So you got to keep
Well,
yourself well hydrated.
I am going to start just putting the salt in my palm because I heard this, and just licking it on my tongue to absorb in my mouth first, and then drinking water because I heard that can help you absorb it better.
Mhm.
I'm going to try that pretty diligently to see if that increases it too.
But I think
All right.
consistency is the key. I used to live in Arizona, and every time it rained, the water, everything would flood because things are so dry. The water just isn't absorbed. And I think the human body
Yeah.
is like that. When you're dehydrated and you begin to drink water, it's not being absorbed. So it's
Well,
like
then
consistency.
I was told too much water's not good because I used to drink almost 1.5 times my body weight, and I was told not to do that. But I like drinking a lot of water, so it's hard for me not to drink more. Have you heard of
No,
that?
you're
Drinking
right.
too
Too
much?
much water, too much water can kill you. You can get
Yeah,
hyponatremia and have problems. So there's a balance. There's a balance.
yeah.
But I like just the
I think it's
general
all
rule.
about what you absorb.
I like the
Just
general
like,
rule, half your body weight in ounces of water. That's a good starting point.
yeah, I definitely get that in. All right, well, I'll have a reconsultation with you after this appointment, and then my remedy's almost gone. So Chris told me let it lapse so I can notice any differences of not
Yeah, and
having it before revisiting it with you.
then we can talk about it then.
All right, thank you.
Okay, thank you. All right, Miss Elaine Olson. Good
Hi.
to see you, Elaine.
No, I'm just so excited to report that so many things are happening that are better right now. And with your help, I'm able to use a microcurrent, and I've been using it on my legs because they got so weak. I had to stop my activities, my sports activities, and I'm getting back into them now. So that's been such a help with that. And the new remedy, I could see a difference physically. I'm stronger. I have a little more energy, and I feel better, and I want to do things. And it's just amazing with the two things together, what an improvement there's been in my life and helping me.
Well, the big question is, how's the pickleball?
I really can't play pickleball for a couple years. It's table tennis or ping pong that I've started playing, and I'm getting my old game back even. So it's kind of exciting for me. Even my golfing I tried golfing, and I'm doing better at that too. So I thank you and the Lord for all these improvements.
Yeah, I'm really happy. I think we got the right remedy.
The only
We
thing
got the
is,
right remedy for you.
I did lose my central vision on my left eye, and it's always been a problem eye, and it's been a problem ever since I got the injections because they gave me so many side effects. And I'm so glad I stopped them too.
Well, good. Really happy we're turning the corner. Next time we talk, I want to hear about the pickleball championship.
Thank you.
Okay, thank you. Thank you for sharing. Let's see, Lois.
Hello, everyone. Yeah, a couple
Lois,
questions.
you're old school. You don't hit the icon with the hand. You just do it.
You know what? I don't know how to do that. I'm so bad with the computer that I mean I'm afraid. So many times I hit the wrong thing and then I get disconnected. So I'm the least computer literate person probably.
Oh, there's a little on mine. There's a little heart.
Okay, well, I have an iPad and I don't know how to get to it's an older iPad and I don't know how to get to the icon. So for now, I just better do it this way if you're okay with that. Some questions. Number one, about the ozone. I know you've mentioned in the past, like when you're making the ozone, actually the smell can, it's not so good for you to smell it. And I think someone else might have mentioned this, but my functional medicine dentist uses ozone in his practice and actually sells, bottles of the ozonated water where you can go in and, buy it and, drink it over the course of that day. And he also uses it when he does, any kind of dental work, so that there's no bacteria or whatever. But I thought that you had mentioned before that it's really not a good idea to drink or swish your mouth with it, especially.
Oh, no, it's fine.
It is. Okay.
Yeah, my friend Dr. Robert Rowan drinks ozonated water all the time.
Okay, so you're okay with that then?
Oh yeah,
Okay.
it's fine. Well, first of all, the ozone will help kill any type of pollutants in the water, bacteria or viruses.
Right,
So
right.
there's a small amount that may be absorbed into your body, not that much. I mean,
Okay,
it's not
okay.
going to replace rectal insufflation or auricular.
Right,
A
okay,
small
okay.
amount will get into your body.
Right, okay, okay. Well, that's good to know. Thank you. Then let's see. I'm losing my train of thought here. My next question is, a couple people have talked about this, the dry eyes and everything. And, I just have so much trouble with dry eyes. And it's like everything from my neck up is very dry. My mouth, my nose, and my eyes. And I drink water all day long. And all it does is make me go to the bathroom more. And I'm also noticing, and I've had this off and on for a while now, when I use the microcurrent, especially when I use the gloves, sometimes I have like a a stinging or an itching. And, you know, the gloves are clean, the washcloths are clean, they're wet enough and everything. But when I mentioned this to Chris a week or two ago, she said sometimes that's because you may not, you know, you may not be well enough hydrated, but you also may need electrolytes. And she couldn't remember it, but she said she thought that at some point in the past you had some type of powder or whatever that you put in water to help hydrate yourself better.
Yeah, we used to supply that in our office. It was an electrolyte solution. I'm gonna have to do some research on that.
Okay. And
See
then
if I
when,
can find the name of that product.
okay. Because I know I do have, you know, the trace minerals, you know, the bottle of is it Concentrace is the company or something like that, but I didn't know if that would work. And then,
Also, a pinch of Himalayan sea salt in
okay.
your drinking water will
Okay.
add a lot of trace minerals too.
Okay. And then also years ago, my naturopath told me this, that she said, put like a splash of, you know, like organic, fresh, if you can get fresh fruit juice in it, not a lot, just a little splash to kind of maybe flavor the water a little bit. And that might help with the hydration. So maybe I'll get back to that. The other question is, you know, I'm overdue for the homeopathic consult with you, and I'm filling out the sheets, but I'm having a lot of trouble with that when you know, it's like when I fill it out, it like it moves the header for the next page down down to the middle of the page and everything. And then also I was working on it again. I've been working on it the last 3 days, and I was working on it again last night. But also when I'm done filling it out, I don't know how. I guess I need to call Chris about this, maybe more than you, but when I'm done filling the whole thing out, I don't know how to, you know, it's a PDF. I don't know how to get it back to you. I'm not finding an icon or whatever that says to mail it back.
I think you better talk to Chris.
Okay. I'm afraid what's going to happen.
I think it's a matter of saving it and then
Okay.
emailing a copy of it.
Okay. All right. Okay. Because I'm just not good with that, and I'm afraid I'm going to get the whole thing filled out and then do something wrong and lose it.
Don't let it frustrate you, because that questionnaire is just a tool that can help me. But
Okay.
sometimes I like to do it the old-fashioned way and just ask you the questions.
Okay. All right. Okay. Good. And then when we do meet, I have you know, I'm having a total shoulder replacement in a month. And so I'm going to have a bunch of questions for you, because more than likely I'm going to have to go to a skilled nursing facility for a week, because I'm going to have a pain pump in my neck where my entire shoulder and right arm are going to be numb and totally, you know, floppy and all that. So, you know, I'll have to stop my remedy, stop the microcurrent. And, you know, I'm just trying. So I'll need to talk to you about, you know, what things can I do, you know, to help with all
Yeah, I
that
think we
process.
can talk about some suggestions that may help, even
Okay.
using the microcurrent and maybe even a homeopathic remedy for the pain, you know, get you off your eye remedy and get one focused on the pain.
Okay. All right. Okay. Good. Thank you so much.
All right, and good luck with that surgery. We'll talk.
Yeah, I know. I'm not looking forward to it, but I'm to the point where I'm totally right-handed, and I can barely use my arm for anything. The shoulder joint is just totally destroyed. So,
Well,
but
you
you know,
better learn. You better learn how to use the react button to click
yeah.
things. Because after the surgery, you're not going to be able to do this. You're not going to raise your hand. So.
Yeah. Right. Yeah.
All right. Okay, let's move on to Meryl.
Yes, hello. Can you hear me?
Yep, we hear you.
Yeah.
How are you doing?
Good, thank you. Just a question. You just mentioned flaxseed oil. Can you take that if you're on blood thinner?
Yeah, I think there shouldn't be a problem. You may want to consult with your internist or cardiologist. It shouldn't be an issue. Sometimes they, if you're on blood thinners, they recommend you don't take any extra vitamin E. That can thin your blood, but I don't think there's an issue with flaxseed oil.
Okay. All right.
That shouldn't be a problem.
As far as eating salmon, it has a lot of mercury in it, doesn't it?
Yeah, you have to be careful. I think fish in moderation is okay. I'm just against the fish oil because it's concentrated. Who's that good-looking boy there? Hey,
This is Hayden.
hey, Hayden, you helping Grandma, huh?
Yeah. Yeah, okay, so it's just a question I wondered, is it all right to take it in capsule form?
No, I think any type. Oh, you're talking about the flaxseed oil?
Yes, right.
Yeah, flaxseed oil is perfect in capsule form.
Okay, good. All right, thank you.
All right, thank you. Okay, you're labeled as me.
Yes, I've been working on changing that, but I know how to do it now, but I can't print it out.
I'll
to
refresh my memory. I'm sorry, I don't.
Frank Taylor
Frank,
in
yeah.
Fort Myers. Well, anyway, I have a pair of binoculars, 7 by 35 power, inexpensive, and I happen to have them outside. And I walked out front, and about, if I go look either way, it's about a football field at least, and I can see perfectly clear. And if I take them off and put sunglasses back on, I don't have that kind of vision. Why does that make it so clear, the binoculars versus any other type of glasses? Because I can't walk around with them, you know?
Well, it's probably magnifying a healthy part of your retina.
Oh, huh. Okay.
The other thing you may want to do is you may want to try pinhole glasses. Have you tried those?
No. Hold on. What are they?
Pinhole glasses will isolate a healthy part of your retina. And you can buy pinhole glasses on Amazon.com. They're very simple glasses. It's just multiple holes. It's a black lens with multiple holes, and you would put that over top of your regular glasses.
And that helps you see better, or?
Yeah, it does with many people because it'll isolate the healthy part of your retina.
Okay, well, that's good news. Glad I asked that, because I think I'm losing my mind, because I could read down the street, the mailbox have numbers, house numbers. I thought I could see them. Like, how could this be? You know. So, okay,
Well, that's actually a good sign, because that means that there's part of your retina that's functioning well. We got to get that part to either expand or your brain start to use it.
Yeah, I have seen. We had a talk about almost a month ago, and you recommended a couple things, but the switch of the glasses for the light therapy, and Chris sent them, and they got lost, and she's going to send us a second pair, and I'm like, get them here. But anyway, I have two. I'm getting ahead of myself. Before and since I've been having macular degeneration issues, I would just look at stuff with not trying to focus on anything. And I noticed on TV mostly, I could see the background behind a newscaster, and it was like a pegboard, where in fact it was a plain wall. And then I noticed in different rooms, I have a dark tone paint, and I could see the pegboard formation again. Like, I don't know how it would get there. So since the talk we had, I was just using the number one, the AMD protocol. And the one on 4, which is the sense, brain, and sensory protocol. And I tried that once, and my eyes got blurry after I used it, so I stopped using it. And you said something about it, so now I use the 1 and 4 together, and my eye vision has improved, and the pegboard thing is gone. So I'm real extremely happy, you know. And but anyway,
No, I like the combination of 1 and 4. I think 1 is probably the most valuable program, for your eyes, but number 4, the brain and sensory.
Right. Well, that's what
Help.
I do that, and most of the ones that were yours that were in that, and then I had a choice of 6 through 10, and 1 through 5. There's the detox and all that. Is there any other ones beside 1 and 4 that would help my eyes specifically, or? I mean,
Well, the other one is probably the stress or relaxation.
Okay, is
Because I
that number?
feel that the body will not regenerate, the body will not heal if you're in a stress
Okay.
situation, when
Okay,
you're
that's
in that
number
fight or
3.
flight.
Okay. Any others that I was doing the detox, plain whatever that it means, but it was just
Well, I think if you're undergoing chelation and you have toxins in your body, then that may be of value. But if you're conscientious and you're eating well and you're avoiding, any food that has a label on it, then I
good
think
stuff, you
probably
mean.
don't be, yeah, good stuff. But there just isn't enough time in the day to do all the programs. But if you
Yeah.
have time,
No. Yeah.
do them all.
Okay.
And
Well,
I'm happy you got the right combination.
yeah, I'm on the suppository and the 4 EDP or whatever they are pills, and so I'm thinking that works well. I'm my 3rd tin coming up. So, but I notice a difference that I'm doing better since we had the talk, and I picked up the number 4 one. So this has all been good. So there was a lady on yesterday with Chris. I thought she was on today. That said she went and had a treatment for heavy metals, a laser treatment to clean them or something. Is that? Did you hear that ever?
I'm not aware of that. There's laser treatments to put energy into your body. It's called ultra violet blood irradiation,
Oh,
where they take out some of your blood and they irradiate it with ultraviolet light. But I'm
huh.
not aware of any laser treatment to detoxify your body.
Well,
Okay.
I'm the one that had that done,
Oh,
and my homeopathic doctor said he has devised his own protocol for this, and he's had success with it, and it detoxes you. It gets rid of the lead and the mercury. As I have felt better, I'm going to get another blood urine test to confirm that it worked because
And how
wow,
is it done? How is
I'm
it
sorry,
done,
what?
Paula? How is it done?
You lie, well, you lie down and he takes a laser pointer to your different acupuncture places, meridians, and he goes up and down your body. It's really fast. He made me sign something that I wouldn't tell too many details about it. It's his
Well,
new protocol.
that treatment is really not widely accepted because I talk with a lot of top alternative doctors and no one's doing that treatment. So I'm a
Oh,
little suspicious. And of
okay,
course,
well,
I would like confirmation with the urine challenge test.
I'll do that. Absolutely.
You
And let
know,
everybody know.
yeah. So the urine challenge test, as you're all aware of, that's the most accurate way to measure heavy
Yeah,
metals in your body.
correct. I have felt better since he did it though. So,
Oh, maybe send me some information on the doctor and I can do some research.
sure.
Based on the idea.
I have a question. I don't know if I don't want to interrupt
Yeah,
anybody.
you're up. Yeah.
Well, in the middle of the night when I have to get up and and there's a little bit of light in the room, there's big black spots in my eyes. When I turn on the light, it disappears. But I'm wondering, is that a sign of my macular degeneration? My optometrist said it was just the way I was lying and that's the blood collects there. So I wanted to know about that. Have you ever heard of big black
That's
spots?
a strange symptom and I'm not sure. So you see the black spots at night and they disappear during the day?
I see black spots in dim light and they disappear the minute I put the light on.
Well, that could be just simple, some benign floaters in your eye. And, you know, the bright lights are just going through them so you don't see it.
Well, it's pretty distinct. It's huge in my vision. I
Yeah.
don't
But
know.
they disappear in natural
They
light.
disappear when, yeah, when I turn the light bulb on, they go away.
Yeah.
So
I
that's
I
not
can't,
connected with.
I think this is probably just some floaters in the eye. Normally, the changes in the jelly of the eye, and you may have floaters, and depending on the intensity of the light, they may be more prominent or not prominent.
Hmm.
It doesn't sound like macular degeneration.
Yeah. If I can just interrupt, I get the same thing. It's like a huge black oval waffle.
Yeah.
And
Right.
it's scary because sometimes when I walk into the bathroom and I have a little tiny red night light there, but it's like there's this big spot on the floor. But then, like you said, Paula, when I turn on the light, it goes away.
Yeah.
Oh, you know what that sounds like? It sounds like, and it's common in macular degeneration, your retinal cells are not functioning properly. So they need more
Okay.
light to turn on. So
Okay.
in a dimly lit room, there's not enough photons to stimulate the retinal cells. Then when
Okay.
you go into a lighter room, so it sounds like that is, if you're referring to like one central area,
Yes.
Yeah.
It's yeah.
if it's
Right.
one central area, it's probably the functioning of the retina,
Okay. Okay. Like in the rods and cones or something
like
like
the
that.
rods and cones. They're not functioning that well. They're
Okay.
not able to absorb enough light in a dimly lit room. But when in a bright room, you're getting more light intensity and they're able to function.
Okay. And I will say, I've had that off and on for a few years now, but it'll be 2 years in September that I've been on your program, and it still happens, but it's much less.
Well, that's a good sign. That means that the
Yes.
retina is starting to function better.
Yes.
So now I understand what you're talking about, Paula.
Yeah. Well,
So
that
we should,
happened to me many years ago. I've been having this like I can remember
Mhm.
4 or 5 years I've had this. No
Me
one
too.
said anything, so that's interesting.
so I
Yeah.
think that with proper treatment, we would like to see those become less prominent,
Yeah.
like Lois describes. But that may
Right.
be a good way to evaluate the effectiveness of treatment. Are
Right.
those black circles getting smaller?
Yeah.
Right. Okay.
What about rutin? Have you ever heard of the drug called rutin? It's a supplement that they in France people take it. The waiters take it to help their blood vessels be stronger. So I thought, well, maybe that could help the blood vessels in my eye. I don't know. Have you ever heard of
No, I heard of
rutin?
Ruta. There's homeopathic Ruta, but not Rutin.
RutenIN. Oh, okay. Well,
I'll have to do some research on that.
yeah.
Rutin.
Yeah, rutin.
Oh,
And
it's a glycoside in a wide variety of plants, including citrus.
uh-huh.
But I'm not aware of it helping the blood vessels. But
They've used it for years.
Yeah.
it benefits improving blood circulation and reducing inflammation. So it looks like it could be a valuable supplement.
Yep.
Yeah.
I'm not a big advocate of, looking for a miracle cure with one element.
Yeah.
I think if you have a good healthy diet, you're probably getting some rutin in what you eat, but All right, Jennifer.
This isn't why I put my hand up, but
You're just
around the
stretching.
topic of, oh yeah, around the topic of low light conditions, I have glaucoma, and I find that I need more light in a room than most people do. And is that typical in people with glaucoma?
Definitely, because the optic nerve is not transmitting the light that effectively to the brain.
I
So the
see.
more light you have, the better
Right,
conductivity.
right. Yeah. But it's kind of a balancing act because I also don't do well in
Mhm.
direct sunlight or light that's too much.
Mm.
But that's sort of an ongoing thing where I walk into a room and I crave to have more light than anybody else seems to need. So,
But also
okay,
getting
so,
back to macular degeneration, one of the earliest signs of macular degeneration is the inability to transition from a
mhm,
bright room to a dark room and a dark room to a light room.
mhm.
When you have macular, you walk into a dark room and it's really hard for your eyes to adjust.
Well, I mean, that's something I have experienced also when I walk into a movie theater. I have to, before climbing the stairs or finding my seat, I have to wait a
Yeah,
few moments.
and that's due to the
And
health of the rods and cones in your eye. They're not
okay,
functioning to the best of their ability.
and that's an aspect of macular degeneration.
Aspect of macular degeneration and probably also an aspect of glaucoma too.
Okay.
So
So
that
how does,
we would evaluate those over time, doing the microcurrent treatment, the light therapy, we would expect those symptoms to lessen
Mhm.
and your
S-
ability to transition from a dimly
right,
lit room
okay,
to improve.
right. So how does one get the diagnosis of macular degeneration?
Well, it's by, a thorough eye. We look at the retina.
Oh, okay. So I could
We
just
can
ask my
see,
glaucoma specialist the next time I see
I'm
him.
sure that he does pictures of your eye and it's an easy diagnosis to make. It's
Okay,
interesting. One of the quickest ways to make it, when an eye doctor looks into your eye with that ophthalmoscope,
right.
he looks for what they call a light reflex. When he looks
Mm-hmm.
at the macula, it's like a light reflex. It's almost like it's glowing.
Oh,
And they call it the macula lutea, the lutea. And it's like a
uh-huh.
yellow. It's a yellow. And really, nutrition has a lot to do with it because if you're deficient in carotenoids and bioflavonoids, you lose that macula lutea.
Ah,
So if an eye doctor looks into your eye and there's no macula lutea, he knows that you're either nutritionally deficient or you're starting to get early macular degeneration.
okay.
So it gets back to the basics, good nutrition
Right.
is
All right.
essential for the functioning of the retina. So you
Got
can
it.
do microcurrent and light therapy and homeopathy, but if you don't have good nutrition, and my saying is colorful food will give you colorful vision.
Got it.
So the more food you eat with color, red tomatoes, green peppers, carrots that have yellow, all those things
Right.
bringing life to the macula.
Right.
It craves all those bioflavonoids to function properly.
Got it.
But of
Okay.
course, the optic nerve is a little bit different. The optic nerve is part of the nervous system. So you need more healthy fats, like the omega-3s
Right.
and other minerals that are involved with neuroconduction, like magnesium.
All right.
So
Now, the
it's a
reason I
different part of
raised
the
my,
eye.
oh, I'm sorry. Go ahead.
It's a different part of the eye, so there's different nutrients that are needed.
Right. And the nervous system needs, what did you say again?
Well, you need the
Oh,
omega-3s.
maybe. Oh, got it. Right. So I raised my hand to ask you about the detox program on my microcurrent machine. I don't use it very often just because I can't use them all, but but since I'm doing IV chelation therapy, is there an optimal time to use the detox program?
Oh, yeah, I would say right after you
Okay.
do your IV chelation,
Uh-huh. All
when
right.
you come home after the IV chelation, that's when I would
Okay.
say do the detox. Because
Got it.
the detox program is strengthening the kidney and the liver of your body to help your body with its natural detox.
Hi, but that's okay. Do I take this remedy?
Okay, thank you.
Okay. All right. I think we have time for one more question. We're coming to the end of the hour here. Anybody else have wait, I think somebody put a question in chat. Oh, I usually post them. I'll send the recordings to the group, okay? The question is, where are the recordings of our meetings? I'd like to review any meetings that I've missed. Okay, so I'll be posting them to the group. Thanks for reminding me.
Good, good, good.
Both Amaryllis and Cynthia have been waving their hands. I just
Okay,
wanted
Lois.
Okay, just real quick, I had a question too about the light bulb for syntonic light therapy. Mine burned out, and I have two 15-watt bulbs that are from General Electric that say soft white incandescent, but they don't say frosted. And Chris wasn't sure if they would work properly or not.
No, that they would work. They would work fine. You want to
Okay.
just get a low wattage.
Okay, and then my other question is it better to have them in a regular lamp where, you know, you take the shade off and the light bulb is standing up, or I've been using a gooseneck?
Yeah, you want a gooseneck lamp to direct the light energy in one
Okay.
direction. That would be
Okay,
that.
and then inside the gooseneck lamp, it's all white. That's okay?
That would
Okay,
be
great.
perfect. Yeah.
Okay, great. Thank you.
Amarilla, sorry that I neglected you. I can't see everybody's hand. I think you have to learn how to use that little react button and raise your hand.
Okay. Don't have one.
Oh, you have to unmute, Amaryllis.
We
You have
don't.
to,
Yes, my question is the following. Are you listening to me?
yep, I'm listening. I see you
Okay.
and I can hear you.
Okay. On our first meeting, you asked me several questions. One of them was if
Where
bright light annoyed me.
bottom?
And at the moment, I couldn't think of anything because I told you I do not expose myself to bright lights, but I have been noticing, and I am aware now that LED lights, those white lights, and the screen and telephone lights, they are very annoying to me.
Is
I
this
changed
something
all
new?
my house lights for
Well, is
incandescent.
this something new or has this been going on?
No, that's been going on. It is not new, but I forgot about that. I wonder if the homeopathic you gave to me would have been different if I had told you at that moment. Yes, they are very annoying
No,
to
well,
me. Not natural light. Natural light doesn't bother me.
we look at many different symptoms. So that's just one factor.
Okay.
It's unlikely that would determine or change the remedy.
All right. All right. Well, I'll
But then
keep
again,
taking
then again, the
arsenicum.
only way we know is how the remedy affects you over time.
Okay.
So if you're taking the remedy for a couple weeks to a month and there's no change, then we have to look at maybe changing the remedy.
Well, I have been 2 months since I started the program, and I feel calmer, but my vision is the same. And 2 nights ago, it was very distorted. I am still making changes. I will eat more raw food and take more sun directly in my skin and things like that. I'm still making changes.
Yeah, well, the first thing we like to see with the homeopathic remedy is a change in the mental emotional.
Yeah.
More energy. We like to see that.
It's been
many times
nicer.
the physical will come later.
Okay.
But usually the physical takes a little bit longer, especially if you've had eye problems for a long period of time.
Yeah.
You
It's
know,
okay.
the analogy is that I like to use, you have a big boulder that's rolling down the hill. The first thing you got to do is stop the boulder from rolling. Then the next thing is push the boulder up the hill.
Yes.
All right.
All right.
Anyway, thank you all for attending, and we'll be getting together again in 2 more weeks. But any other questions, make sure you join Chris's meeting And, you know, I talk with her every day. If she can't answer your question, then, you know, I'll help Chris formulate an answer. Anyway, blessings to all of you. Enjoy the rest of the
Thank
summer.
you.
I'll
Thank
talk
you.
to you in a couple
Thank
weeks.
you.
Thank
Okay.
you.
Thank you.
Bye.
Okay,
Bye-bye.
bye.
Bye.